This conference will now be recorded.
Hi, everybody, and welcome. Tonight is RMC support group, and we are so glad to have all of our friends returning again. I am going to go around as I see you on my computer and check in with each and every one of you. If there's anything on your mind tonight, anything we need to talk about. I am Alexa. I am so glad to be a member of the RMC community and a moderator here for this group. So I'm just going to go by how I see you. Richie, do you have anything on your mind tonight?
No, not right now. I'll just share a little bit, maybe about going through the process with meeting the advocacy days, the past 2 days.
That would be great. So an advocacy update is on the agenda tonight. I will keep that in mind. Carissa, beached out. Do you have anything on your mind?
Not right now.
Sure. Nicola, coming from us live from the UK. Is there anything on your mind tonight?
No, just glad to be joining you. It's been a while.
We're very glad. Yes, It has been. We're just glad you're back.
Yeah.
Thank you. Lori, is there anything on your mind tonight? Do you need time? Okay. And then Brian and Anissa, hi. Hello, both of you. And you both can answer since there's two of you. I can ask you separately, but I think it's more efficient if I just ask you together. Is there anything on your mind? Do you need time tonight?
Nothing on my mind, just joining the group and saying hi to everybody.
I do want to and I'm putting you on the spot because this is recorded. You're having a good day and I want to celebrate that. I think Richie has talked about before, you just have got to celebrate the good days with RMC and you just hold on to that. And so I just wanted to make some pomp and circumstance for that because it's just, woo, good day. Milton.
Alexa, may I ask you a quick question of Richie about whether I should share? Richie, did you share about Kwanzaa getting married?
No, just briefly. I told him a little bit, but I would love for you to share what
I thought that might be something that you guys might want to hear. Yeah, sorry.
That is something we'd want to hear.
We would love to hear that.
We'd love to hear it, absolutely. Milton, can you hear me okay?
Quite well.
Okay, perfect. Is there anything on your mind tonight? Do you need time?
Just, I guess, the events of of today. Other than that, there was I think her name. I apologize for not remembering her. Jennifer from VHL Alliance. She's she's an advocate for VHL Alliance, and VHL is the acronym for a genetic mutation that her son has, and it was very interesting. He's I guess same age as my son or a year older, but in telling my story, she mentioned a drug that's in clinical trials that let me see. I scanned a little bit of info on it, and it had reduced the tumors by I believe after 1 year or within a time frame 30%. And I'm trying to on my phone find the name of this drug and the trial. It's on my phone, but I just don't want to disconnect or anything like that. But anyhow, I mentioned it to Micah's new oncologist, and she immediately looked up the information and told me that although the patient with VHL, they might have RCC as one of the cancers that or tumors that might come that might appear in their body, because there's various tumors that the disease itself is very tragic. Anyhow, when I spoke to Micah's physician, she immediately got on it, looked it up, and told me about it. Said that as far as she knows, that based on what the information that she was looking at, that it's only specific to that particular disease. And I think she's going to do some further research on it. But then she said I should also consider joining, which I did, but I never followed through on the email. What's it called? Smart Patient, I believe. Anyone heard of that? Smart Patient. Is that, Richie, am I saying correctly?
Yes, it's Smart Patient. It's a forum for patients to get on and talk to each other. It's something like Inspire.
Okay.
Yeah, community communication with each other with similar diagnosis.
Yeah, well, she mentioned suggested I go on that because she said that sometimes the other patients share information that she might not have knowledge of right away. And I thought that was very cool for her to say that, and admitting that in a way that, okay, there are things out there that she might not be aware of, but she's extremely interested in knowing about it. So, I guess I felt a certain, like, as if her willingness to listen to me or any input I might have is, hey, this is probably available. Can you look into it? And I found that kind of, refreshing or inspiring that at least one, I learned something about a different disease. Two, and another advocate from reached out to me. And three, that when I shared that information to my physician, Micah's physician, she was more than willing to look into it. So that turned out pretty good. He had chemo scheduled for today, and again, it didn't happen. So we're going to try again. This is the third time we're going to try this coming Friday. So there's some complications that's been going on. But we're in a new hospital, so has some challenges. We have when I mentioned to her that this is the second visit that we've had, and we've been waiting to be seen or processed for both times over an hour and a half. And I guess I was, in my previous place, I was kind of spoiled because everything worked like clockwork, and she did mention that they're short of staff because a number of people had quit as opposed to taking. I guess they didn't want to be vaccinated. So those staff members who did not want to be vaccinated, they either resigned, and this is the support staff, which makes the hospital run, and so it affects everyone. Us as patients and advocates, I should say healthcare provider. It was a little frustrating, and I expressed that to her because even Micah he's beginning to get a little hesitant about the whole process. But then we understand what's going on. It's a different climate with with COVID and everything else, and some people in the healthcare profession do not want to be vaccinated, but it affects everyone, and it has affected us on our 2 visits. But we're not giving up. I told his physician that I know it has nothing to do with her, and it doesn't. But I said, and she said that the other doctors are noticing it too. That it's a frustration on everyone's part and what they're encountering.
Well, I'm sorry to hear about kind of the struggles in the clinic, and I'm hoping that Micah is gonna have a good round of chemo. I'm really hoping it's gonna go smoothly, and hopefully that won't affect the infusion center or anything like that.
Yeah, yeah. He has to have a procedure, another paracentesis, and something very interesting. Potentially, he was with his chemo, the last chemo, he could have been. Well, the new position is reducing the dosage because his platelet counts have been down for 2 visits, and that was based on the second round. And she's theorized, and it's not even a theory. She said that the drug is given based on his body weight. In actuality, some of his body weight is the excess fluid he's carrying, which is not a true indicator. And because of that, the dosage she suspects has been too high, and his body's having a difficult time recovering. So that's what we are. But that's new information for that I never understood, and was great hearing that. And of course, she's also an assistant or associate professor at the university. So it was, I guess I was in the classroom today, and it was in spite of everything, I'm exhausted, but it was a positive spin at the end of the day.
Well, that's good news, especially with some of the other issues you've had with other providers. That's great news. Andre, welcome. Hello. Can you let us know, is there anything on your mind tonight? Anything you need to say?
I don't have anything tonight. I do have an upcoming CT scan on the 18th, so I'll be in Houston. So yeah, that's all I got.
All right, and we're already believing that's gonna be a great scan. So
I already know.
All right, great scan. Richie, could you please give us an advocacy update? That sounds so official. I feel like I'm on CNN and I am throwing it to a correspondent on Capitol Hill. But would you please update us? What is going on advocacy-wise with RMC?
Well, it's interesting. We joined forces with Kidney Can, and actually Milton also did some advocacy the past couple days, and basically asking for more funding for research, billions of dollars basically. We had an opportunity to, in fact, in my group, I talked to 6 staffers for Texas. Majority of them, I would say, were very accommodating. They seemed interested. They stated that the congressmen were interested in supporting kidney research because it's global. It's not just specifically to RMC, but I do know from the NIH, we've gotten money to do research for RMC. So the ask is out there, and let me see if I could find the ask, and I could just tell you. I had them earlier. Let's see. And it's amazing that how much they really don't know about kidney cancer. But the ask basically from the cancer community was to maintain the $50 million currently allocated for KCRP for fiscal year 2022. And then they want to increase the NIH budget by $3.5 million for fiscal year 2022. And then to support the creation of ARPA, this is the Advanced Research Projects Agency, Health, at NIH with an additional $3 billion. And then to continue supporting legislative initiatives that contribute to robust, sustainable funding for medical research. Now, Milton and I also wrote letters specifically from the Chris Johnson Foundation in regards to RMC, and we are basically asking for, where's my letter? We're basically asking for more funding so that we can educate more people, and not just the community, but also the medical staff, as well as maybe expanding Medicaid opportunities so that we can ease the access to clinical trials, in the United States. It's good to have clinical trials, but it's not any good if the people that need the trial is not able to access the system. So those are basically the things we ask for, and hoping that one of the congressmen will pick it up and write a bill for us and take it and see how far we can get with it. So that's what we've been doing, and we're asking and encouraging everyone to send those letters to the congressman. We had basically the same body, but we tweaked it with our own personal story, and it's the personal story that usually resonate in their mind, so that when something does come up, then they remember and more apt to vote for it. So that's what we've been doing.
So Richie, can you explain to us, since you are in the medical profession, can you just explain really quick why it's important to make sure that funding remains stable, and why approving for the NIH and that type of stuff, why that's an important ask for RMC? Like, how does that affect the community?
Well, without the funding, you will not have the ability to do the research. And research is necessary in order to have more treatment modalities for patients with RMC. So it costs. And a lot of times the pharma, well, I call them pharma, but the pharmaceutical companies don't always pick up the slack. So if you have funding from NIH, of course, the physician has to apply for this funding. It's not just going to be, say, we're going to give you so many millions of dollars. It's just that they have to apply for it. It's in a big pool, but it is there for them to access it. So that's another thing we have to do, is encourage our physicians to at least apply for it. So without the funding, you won't have your research, and therefore RMC will be on the back burner, as it had been for 2 decades.
Thank you. I thought that was really important, because sometimes I feel like I do political advocating for myself for all different types of cancer. Sometimes whenever I want to encourage everybody, sometimes you feel like, well, I feel bad about asking for that. And so we understand what you're asking for, and understanding that these people, they work for you. They need to hear what's important to you as a constituent. And it's always an important thing to be caring about everybody, because this funding affects the whole cancer community. So you're asking for really big things that are going to help people. I had an actual lobbyist explain to cancer in the cancer community, you're not asking for the rainforest to be demolished. You're not asking for anything bad to happen to puppies. You are asking to help save people's lives. So definitely, if you haven't sent out a letter yet, or if you haven't talked to anybody yet, a lot of these people are usually really nice, and they want to hear you, and they want to hear your story. So I just want to put a big plug for that, because change happens at a political level with conditions. And as Richie knows much more than me, it is very unfortunate that so much work has to be done as when you're a patient or a loved one, when there's other conditions that have all these groups, and they have, like, if you think of breast cancer, Susan G. Komen, and all these other types. And it's so frustrating that you as a patient have to be the educator and the advocate and asking for funding. And I know that with Richie spearheading everything, that's going to improve, and Nicola in the UK, that's going to improve. So thank you for providing that very important update, Richie, live from Texas.
Well, thank you.
She's changing the world. Lori, I would love to give you the floor. We talked a little bit last meeting about what you're going to talk about, but we would love to hear anything you have to say. You have the floor.
Yeah, and I'll try not to cry too, Rich, so I don't set everybody off. As you guys probably know, because I'm not even sure, I know I was last here in June, and Kwanzaa's cancer had spread sort of throughout her abdomen. And they found that it was effectively choking off her colon. And in around the 9th, they performed a colonostomy so that she had an opening in her abdomen. And as she said, she didn't really have a choice. They kind of were like, you can die or you can do this. And then she woke up and here she was, and she found that disconcerting. And I think it took about a week for her to accept and kind of come to a place with it. And then her second kidney started to fail, and they performed a nephrostomy where they put a tube in your back and drained urine that way. So they were going to discharge her to hospice, and her mother her mother was coming into town because her mother had been, the hospital had sort of said it was her mother should come into town from Georgia because we were in California. And she already had a sorority sister or two who were going to be in town. And I had her best friend called me separately and said, you know, I'm not planning to come for another week or two. And I said, you know, I'll just come now. So Kwanzaa and Michael were discussing their how they had not gotten engaged with the chaplain the day before she was supposed to be discharged. And they said, do people ever get married, you know, in this circumstance? And the chaplain said, yes, of course they do. And so Kwanzaa said, well, I think Michael's going to ask me to marry him because I've got all these people coming into town. And so this has always been part of the plan. He was going to ask me to marry him this way. And Michael was completely down with it. He was like, you know, okay, you know, all right, okay, I can see this coming. And so I was in the process of getting the apartment ready because they had a studio apartment that they were coming back to, getting the dog in place, you know, on and on, all these things, and making room for the hospital bed because it was a very small place. And then everybody sort of came into town, and the girlfriends ran out and bought rings, and then one of the girlfriend's mothers came, and I don't know what, so the mother was there and the girlfriends were there and everything else. And I had an obligation. I couldn't believe this. I had an obligation. I was supposed to be somewhere Saturday night where my husband and I we were the hosts. And so it was like, oh, great. You know, I want to be at this wedding thing or this engagement. And I was like, Michael, you have to ask her parents are divorced. You have to ask her dad for permission. You got to ask her mom for permission. Michael doesn't have any parents anymore. And I said, and you have to get down on one knee. Yeah, it's like, let's not do this wrong. Got to get down on one knee. And so the girlfriends ran out and bought rings. And apparently he got down on one knee and asked her. And then he had scheduled a chaplain to come right after. So at 7 p.m., I'm in the middle of this event that I'm supposed to be hosting. And one of the moms texted and said, would you want to FaceTime in on this? And I was like, of course I want to FaceTime in on this. This is crazy. And it was simply the most beautiful thing I've ever seen in my entire life. I mean, it was just transcendent. And he and she, I mean, he has been by her. I mean, you talk about in sickness and in health. He'd already done all this sickness and health. He'd actually been tested already. Unlike most of the other people who get married, he'd been tested, and he'd done it all. And it was just so joyful. And so I just wanted to tell you all that it was really a very special moment in the midst of all the tragedy that was going on, and to say that for all that she had been through, because even later she went back to the hospital for something and someone was trying to stick a tube in her. I'm like, no more tubes. We're done. Stop. No tubes. But for all that she had been through, there were these moments of extreme joy. And so I just wanted to pass on.
That is beautiful. Just beautiful. Wow. Pretty powerful.
That's just very powerful. And what I like is Lori was an engagement coach. Was just like, you got to do this, you got to do that, pep talk. You know, we're in the fourth quarter, we got to get this done. I love that. I like the way that you described that. That was so great.
I can advocate beyond medicine, okay? I've got some other skills. but seriously, you know, he's 27 and he's having to pull it together in less than 24 hours. In fact, I had bought a cake topper on Amazon that was going to come in Saturday and had not arrived before he slammed this thing together. And I was like, I'm going to accuse you of a shotgun wedding about a moment. This is going really fast. So.
Well, Laura, I want to applaud you because I do know you did reach out to me long before they did. And it's just so awesome. I'm sure she felt the love. You were right there with her and Michael. And that is so important to have that kind of support when you're on this journey. So I applaud you and truly, truly admire your strength. Yes, and we're here for you. Don't think that just because Kwanzaa is not here anymore, we're still here for you. And I will continue to reach out to you until you tell me to stop.
So I wanted to add something to that, Laurie, because I thought when I saw you disenroll, we're never going to see her again, and I was very upset to lose you from the ANCAN when I saw you unsubscribe. We have a really great caregivers group. The second meeting of the month is a grief group. It includes everybody, but we discuss grief. We don't discuss grief in the first meeting of the month. So Carissa is there sometimes, and Alexa's there sometimes, and I cannot resubscribe you. You'd have to go back onto and subscribe again. But if you want to subscribe for the caregivers notices, and the ladies who run it are great, right? Carissa and Alexa. So we have you in that. It's the third Tuesday of every month, and you are so welcome. And anything we can do to support you, we'd love to have you there. So I just want to say, and I looked at the screen quickly. I said, "Oh, great, Laurie's there." I was really happy for that. So that's all I wanted to say. Sorry, I'm late.
No, thank you very much. It's very kind of you.
Yeah, isn't Pat actually going to be in California, or is she in California now? Pat? Wasn't she going to make a trip? Rick?
Who was in California?
Pat.
You're muted, Rick.
So Pat is making a trip. So the lady who leads this, sorry, this is a very quick digression. She lost her husband to breast cancer, male breast cancer. And she has a car that has his picture on the hood, his old car. And she travels around the country raising awareness for male breast cancer. Because as you probably know, male breast cancer is also a very rare condition. About 3,000 men a year are diagnosed with it. And so she's off on a trip very soon, and she's going to be coming through Tucson. I hope to see her, and she's going to be going to California, and she's going to see Sylvester, and she's going to see a whole bunch of us. So she'll be moving around.
In the Marvin Mobile.
The Marvin Mobile. Right.
Carissa, did you?
Oh, I'm sorry.
No, go ahead, Richie.
No, I was just going to say I would like to hear from Brian and Anessa since this is Brian's first time on.
Yep. How's it going, guys? So, I recently had my second dose of chemo this past Friday. I'm in Houston with Dr. Masao, and so far the process has been it's been a little rough. First few days after chemo is usually the hardest, but after that it tends to get a little bit better. Symptom-wise, usually just fatigue and body aches. Hair started to fall out, so I just went ahead and just got rid of all of it. I mean, other than that, I'm just pretty much taking it day by day and just listening to my doctor and just following their plan. So
I think, we've just kind of been tackling everything together. Like right now, we were talking about how is everyone associated with the community of RMC, he's asking me questions just to kind of get a feel for the group. And I think, for us, it's been literally every day we're learning. And I feel like every day we find out new ways to kind of combat some of the symptoms. I will say, like on my side, Brian, I think rough is one thing, but I can honestly say just watching how he's handling everything, it's been very inspiring. And I think that, he's, in my opinion, he kind of just approaches everything like so anyone who's ever been to this is just a funny story, anyone who's ever been to the MD Anderson, like the center, I don't know if you've ever had to go from like the clinic, Mays Clinic, to the main building, but there's a shuttle, right? Okay, so I mean, either way, we make it super fun when we go, like we try to have a good time as much as we can, like in the circumstance. But it was just really funny because once we saw there was a shuttle, I kind of looked at him because he loves stuff like that. So as soon as we got on the shuttle, I looked over and it was like he was on a roller coaster ride, and he just had it. He was like having a blast, and it just kind of puts in perspective. Like this isn't a journey that I don't think any of us really want to be on, and I don't. You would have asked us if anything we wanted to deal with, the answer would be a solid no. But like a hard no, like a hard pass. But I think. If anything, I think we just try to make the best of the situation as much as we can. And honestly, I mean, we haven't been married. I don't. Last time I was on, I didn't see everyone on here. I mean, I don't know if anyone's met me, but Brian was diagnosed back in maybe May.
Yeah, about May.
May, June. Diagnosed in May, and we were married not even a year ago. Our anniversary is actually this month on August 29th. So it's just, I feel like it's brought us even closer together, and I don't know. I didn't think I could love him any more than I do now, but I do. So.
I mean, after the 2020 that everybody had, I didn't expect to be here in 2021. It's still a little surreal to know that every day I wake up, I have RMC, but it's just you just take it one day at a time, and I'm very fortunate to be doing so well with it as I am, because I know not everybody's as fortunate. So I'm just kind of here to support everybody and just listen to everybody's story. So.
By the way, you look great without any hair.
I know, he's like a black Lex Luthor.
Wow.
I love some Luther.
Had a year, man.
I'm sorry, we cut up very often. That's one thing you'll kind of learn about us. We're kind of a mess.
No, more so than me.
Yeah, for sure.
You guys
Our goal is to get Brian and Andre together in August, so we got to pull that off. So we're going to work
it matchmaker, yeah.
work it out.
You guys go to him someplace in your assistant as well. An art that they have, the people who are like.
Carissa, we can't hear you that well. Your audio is being distorted.
Oh, weird.
It's like you're Lex Luthor with some sci-fi effect.
It's like she's an alien or something.
It does. Hi, I'm Carissa. I have a message from my species.
Is that what the ocean does to you?
Maybe Carissa is now a mermaid. Maybe there's some sort of underwater life being at the beach. Maybe this is how she wanted to share it in the group. So we're here for it all.
Can you guys hear me better? Do I still sound like an alien?
That's wonderful.
You're back in human form.
Okay. No, I was just saying you guys should go to Kim's place. It's an arcade area. It's pretty fun, and the people that run it are really awesome and sweet. And they are so funny. They always make me laugh. I always had me and Carlos always had a good time over there, and we get like a lot of, I still have like some Uno cards from there, like their Uno flip. I got to do some karaoke there. I got to sing some songs, and they have like not foosball, but air hockey and some basketball things.
And the air hockey's very loud. I will say that in that room. Carissa, one of the things I'm curious about, because with what you just heard, I think there's some similarities between you and Carlos's story. From you guys were newlyweds. Yeah. So I'm curious if you could talk a little bit about that.
Yeah, and I did catch up with Anessa. She reached out to me on Facebook, and it's crazy how much we have in common. Carlos was in judo. He was black belt. He was a third degree black belt there, so common there. And he got diagnosed after 6 months of us getting married. And that year too, he graduated, started his teaching job. We got married, and 6 months, boom, he got diagnosed with it. So very similar.
And then
story.
Nicola, I think you and Ricky, didn't you two have a very similar situation as well, if I remember correctly?
Yeah, I was just saying it's the first time, obviously, meeting Brian, and I don't know, obviously, the story behind, and obviously how long you've been going through it and things. But yeah, we was 9 months journey. Diagnosed, took about 5 months to diagnose. I mean, yeah, quite soon, quite sudden, hard. We'd only been married 5 months. So yeah, hard.
And I think we should just mention that Nicola's done some amazing stuff in the UK, right, Richie? And so Nicola's actually calling in the middle of the night. But what time is it there? Let me see quickly.
It's 10 to 2 in the morning.
10 to 2, right? You got to it quicker than I was trying to add 8 hours onto my. It's 10 to 2 in the morning, and so she has set up the Ricky Casey Trust.
Yeah, so it'd be great if you could all follow me.
Right, put your stuff in the chat window, Nicola.
Yeah,
and,
yeah.
If anybody doesn't understand what she's saying, I'm happy to translate. This is a fairly heavy Lancashire accent is Nicola has.
Yeah.
But she's done some amazing things. Nick, do you want to do a quick promo, Nicola?
Well, I don't know. I don't feel amazing, but yeah, I've set up the trust in Rick's name, hoping to raise as much awareness and funds and try and get some, because over in the UK there's just nothing. There was nothing like this for me. When Rick got diagnosed, it was literally obviously Richie. I found Richie, but it was too late. You know, Rick was really, really poorly. So I'm trying to do as much as I can in the UK. So we've got more more chance, raise awareness. I've had my first contact a couple of weeks ago that found me. So I was hoping he was going to come on tonight, but he's not. So it's difficult, isn't it, to just make that leap sometimes into a support group when you're in the middle of it. So his friend was going to come on for him. So I'm in contact with them at the moment. So I'm finding that difficult because obviously, you know, it's my first sort of encounter with obviously the same thing. They're asking me now for help, and I've got to try and guide them, and yeah, so hopefully we can do that and try and make some progress in the UK. Yeah.
Well, Nicola, one of the things I'm going to brag on you a little bit, and Rick, actually, we did brag on Nicola a little bit earlier, but I'm just going to keep the party going because, as Rick says, who doesn't like compliments? So Nicola has a really good social media marketing, and she has gotten the attention of a lot of footballers, which for Americans, that is soccer players. But some footballers have retweeted and participated and done some things, and that for UK is like, that's rock star status. So way to go, Nicola. She is doing it out there in the UK, and we're all just behind you. We're all just we need, like, you know, the FC Nicola Casey, we need the flags, we need the chant, we need the scarves, we need everything. So we're just, when you get that big, we'll all have that. Spiritually, we do. Spiritually, we're all here supporting you.
Oh, thank you.
Nicola, just tell me, excuse me, because I don't follow Facebook, who's been retweeting you?
So I've got, as a patron for the trust, I've got Kevin Sinfield. I don't know whether you've heard of him, and David May. So David May's like Manchester United footballer, England. But Kevin Sinfield is like the creme de la creme of the rugby world. So he's a patron now for us and stuff, and he's been running for us and helping raise awareness and things like that. So yeah, feel like we've done quite good there.
Fantastic.
They do a great job with advocacy. Really good.
Yeah. I'm always on it. I think I do everyone's head in.
So I'm curious because I've always said anytime we do check-ins and figure out, do you need time or anything, I always like to say, can change your mind. You're not always locked into that answer. So I'm curious if there's any of the conversations that we've talked about, especially with you, Milton, since we haven't heard from you in a little bit, is there anything that we've talked about that has spurred up any things that to be discussed, or any questions you might have? And if not, that is fine too.
Alexa, I have something I would like.
Sorry, I had my phone on mute. I just realized that. Actually, it's just basically the day I had meeting the Congress persons and the state senators in the kidney can event. So just as I wouldn't say, as a new advocate, and just saying my piece on behalf of the C.J. Johnson Foundation, and explaining to everyone basically a little bit about RMC. We're only given about basically 2 to 3 minutes to speak. I also found from Monday a member of Senator Cory Booker's staff, and today I spoke with a congressman, a member of his staff, Congressman Payne, who I in preparing the letter with Richie that we worked on, and I looked up my local congressperson and discovered that he was a co-chair of 2 committees, one for cancer. So it was a good find, and so even referring him, just letting him be aware of what's going on, and advocating for additional funding. I found that very rewarding. I think boy, Richie was very modest in saying and talking about the letter that she actually created. I just cut and paste a few things, but it was the pieces of legislation that she's asking to be created. I think they're very powerful, and based on my experience in dealing with the various doctors, and with Micah from the beginning, when I have a 19-year-old and they're asking him, does he smoke cigarettes, and he's never touched a cigarette in his life, and them just the lack of knowledge about RMC that I witnessed in the medical community, and the lack of I guess reaching out or finding the best practice among your colleagues at times, or at least that's just what I'm speaking from my personal experience. I think what Richie is suggesting about re-educating the medical community about RMC, it cannot be stressed enough. And part of the funding that the Congress, was through NIH or any other organization, part of it should go towards education, because I think with the education, a lot of I feel that any child or any adult that potentially can get RMC, if there's early detection or knowledge. For example, in 2001, when my son was born, and they told us that he had sickle cell trait, and said there's nothing to worry about. And during his growth, or since and I was raising him, I've always been diligent as far as taking him to all his appointments, and just aware of his health. And if I was aware of potential for him to get RMC as an infant, then I would have taken whatever steps needed to be done. Whether it's, I'm discovering now that the urine samples that has excess protein, that might be an indication of something wrong with the kidney, and that could be a clue. But even these clues that would be present, that even I as a parent, if I was aware of it, of RMC at the time, and of course it's 20 years ago, but even now, I don't think, as far as the medical community and even pediatricians or not, I'm not just picking on pediatricians, but just the community itself, they're unaware of it. And I think a lot of work has to be done like that. It's not for my son, but for how many kids, how many future Micahs are out there. And I have an education background, and that's my concern, and also the parent. And everyone here who has had a loved one who has passed or is currently going through the experience of RMC, I could say that we all feel the same. We do not want that to happen to anyone else. And I think as a community, we have to make our voices heard. And the past 2 days, it was really brought home to me because I never knew that it was the congressional appropriations that they're funding and the research that's being done and the appropriations. It's all new to me. And it was a valuable learning experience today. And moving forward, I'm going to make it my effort to make sure that I will not be silent about this. And I think that's something that we all should do. Yeah.
I love that. And one of the things you just touched on, because I'd like Rich to comment on this a little bit, but Nicola experienced in the UK with Ricky some of the lack of education when it came to RMC. And then I know Andre, even at one of the best facilities in the US, there's still some of the best doctors still don't have all the full knowledge about RMC. And Richie, I know when you were on the Advocating for Your Rare Disease webinar, you touched a little bit on why education at the medical school level is so important. So can you reiterate that point? Because I feel like that's really, really important.
Well, I think first of all, they have to have a base to know what to look for. And patients with sickle cell trait need not be overlooked. And oftentimes they do a 5-minute talk about it and that's it. But to focus more on sickle cell trait, because that is the common denominator for RMC, will allow them to, I think, diagnose these patients much quicker. The first question that should come to their mind, if someone's coming in complaining of back pain or abdominal pain, do you have sickle cell trait? I mean, that needs to be a question asked, and then from there you can proceed with your evaluation of the patient. But so often it's overlooked, and it's overlooked because they're not knowledgeable about it. They basically, sickle cell trait is benign, so therefore they don't know what to look for. They don't know what to ask. So it's extremely important that education is done while in medical school, and then even followed up once they become residents. They need to have more training, what to look for and how to treat this particular cancer. I honestly feel if you catch it soon enough, it definitely improves the survival rate. Whereas if you don't, I mean, it's obvious that it's harder to tackle because this is an extremely aggressive, in fact, one of the most aggressive forms of kidney cancer. So I cannot emphasize enough the importance of having this type of education in the curriculum of the medical schools as well as nursing schools, because a lot of times nurses are the ones at the forefront and tend to do the diagnosing, and helping that physician out because he's always rushing. So it's important. Education is just the key to being on top of RMC.
And Richie, as a nurse that nurses probably spend the majority of their time with just one-on-one patient care. And nurses are some of the best advocates we have besides yourself or a family or a loved one. And also we're seeing that a lot of nurses are becoming nurse practitioners or going to in advanced nursing. And I think that's important too, because we're seeing, especially in pediatrics and family care, more physician assistants and nurse practitioners, and they're an important part of the healthcare team as well.
They are extremely important because they are actually seeing more patients now than the physicians.
Mhm.
And I am not too sure this is in their curriculum either, so it's important that they too become educated as far as RMC is concerned. And I'm sure it's not just RMC that they need to know about. There are other rare cancers, and rare cancers in general tend to get overlooked. Just with RMC, I feel that if Chris hadn't said what he said to Dr. Tanier, I don't think the movement would have gone as quickly as it has. And then him stressing to me the importance of advocacy, because I can honestly tell you, if it hadn't been for Chris, I would not be doing this. He inspired me. If this young man, while receiving treatment, is thinking of others, then the least I can do as his mother is carry out his wish. So I'm just happy to do what I'm doing. I have a wonderful REMC family, and if nothing else has come out of this, I feel the love, I see the love, and I wouldn't trade it. I wouldn't trade it for anything. I mean, yeah, I want my baby back, but I know that's not possible. So the least I can do is take my pain and turn it into something positive. And that's by helping each one of you. I love each one of you. It's my family.
Oh, that's wonderful. And Rick, I wanted to state something very publicly. ANCAN does not have a policy against breaking down and crying. I just want you to clarify that, because I said I didn't think we had a policy about it, and that we encourage feelings, and crying is great here. So
It's all allowed.
all allowed.
So, I just have something up on my screen. I'll share my screen for a second, just so that you can see this, and then I'll take it off. Hold on a minute. There we go. It's coming up right now, and that's Nicola's website, right, Nicola?
She's thumbing up.
There you go. So, can you see it, everybody?
Yes, I could see it.
Yeah. So
oh my gosh, Nicola looks like a Disney princess. Winter Wonderland Disney princess. I'm not sure if I've seen that photo before. I'm like, what does Nicola do? Can she talk to animals? I mean, I have now so many questions.
Beautiful.
Yeah. So you can all go look at that website keep that website in mind along with the Chris Johnson Foundation website, and they go hand in hand, one in this country, one in the UK. So I'll unshare my screen right now. There we go. Whoops, wrong one. That's one. There you go.
It's beautiful. Great job, Nicola. I always get the name wrong. Is it Nicola or Nicola?
You're muted, love.
Nicola.
Nicola. I got you.
Nicola, yeah.
I got you. Beautiful. She's a beautiful person. I remember when we first met. I can't wait.
Have you guys met in person or not?
No.
Not yet.
Only virtually.
Not yet.
One thing I did want to share for Nina and Lois got an opportunity to meet Dr. Masal. He was over in Greece.
Oh, wow.
Yeah. They actually had lunch or dinner together.
Oh, great.
It was so wonderful.
Do we have pictures?
I do have a picture. I have permission from Lois, but I hadn't reached out to Dr. Masal. I want to make sure, before I post. that it's okay, but it's a beautiful picture. I wonder, can I show it on my phone? But it will still show up because it's being recorded. So I'll wait. I'll ask him. I'm sure it'll be okay.
You could put your finger over his head. You could like do like put your hand and like just do half. Like this is a preview. More's
It's
to
a beautiful
come.
picture.
It's a tease, really.
Beautiful. I'll ask him. He's back in town now, so I'll ask.
Funnily enough, and every day I say I'm going to do this, and then the day just gets away. But we have we've recruited a new member to our advisory board who's Greek, a doctor, and we haven't announced it because she's in the process of switching jobs. She was at MD Anderson and she left in December, and so until she announces her new job, we don't want to put up the picture and the bio. But she's in Greece right now too. I know she knows Dr. Masoul very well, and I keep meaning to write to her to make sure she's safe because I have some concerns. So I need to do that.
One
Well,
thing I
she's in
want
Greece. She's having a good time.
I'm
Believe
sure
me.
she's probably parked herself, knowing her, she's probably parked herself on an island that has no trees and lots of water around it. And she's
Probably.
having a great time.
Probably.
I
It's
know.
beautiful.
I know.
I'd like to ask the group, is there anything that's really a burning desire that next month we can bring to you? Is it anything that we're missing? We know we leave this forum open for you to discuss whatever you feel up to, but is it something that we can bring back to you next month?
You know what I would love to hear, like a rapid fire, like how people handle scanxiety. Because Brian gets his first scans probably in the beginning of September after his third cycle. He just got a second transfusion, so it's right after the third transfusion. And like I noticed when we do get our scans, he's like in the zone, you know. I could tell he's like thinking through life. So anything that you could share with us?
Always ready for bad news, but hoping for good.
I think our captain can share something.
Yeah, and I just want to add a couple of things to that. So first of all, Miss Alexa, when's our health anxiety webinar that we're going to do a whole
yeah, so that I think is going to be December
the something. So yeah, but we're doing a health anxiety webinar, and it's going to be moderated by BJ Miller, Dr. BJ Miller, who's a pretty incredible doctor. He's got almost 14 million views on his TED talk, and he's a palliative care doc by training, and he's also a triple amputee, and he is really an incredible guy. I've known him for a long time. He's also going to be doing gives me an opportunity to do another promo. I think Alexa included the flyer in your reminders, but he's going to do a talk for us at the end of this month on managing your healthcare team. Who else do you need in your healthcare team other than your main doctor? What other types of specialties? What can a palliative care doc do for you in that team? And in a lot of places, very hard to get a palliative care doc on your team. And the oncologists don't explain this is the person who's going to help you manage all your symptoms. Palliative care doesn't mean end of life, but they don't explain that. So BJ is going to be there. We've got some great other doctors that are involved. So we'd recommend that. The whole issue around health anxiety, I think, is becoming more and more prevalent. And I think we're seeing it more because of COVID. One of the biggest sections, if you like, segments within health anxiety is scanxiety. We see this all the time. You know, whether it's your scans, whether you're waiting for a test result, depends what your markers are. And I don't have a good answer on how to handle it. but I'm sure hoping that BJ and his team do. One other thing that I wanted to mention to you on the Scanxiety with BJ is that he now has a new organization called mentalhealth.org, METTLE health, mentalhealth.org. And his group does some counseling, and it's not that expensive. I think they have a introductory package. It's about, I don't quote me, but I seem to think it's like $220 for 5 sessions or 4 sessions or something. And his all his counselors and the people that work with him, and he himself, if you can get him, are really, really expert in handling scanxiety. I've seen it. I've seen it with guys who have had BJ on their team and they can't wait to talk to him every 2 weeks. So that's
if you'd
one.
like to see a preview of BJ's style of working with people, there is a very popular documentary called Endgame on Netflix, and you actually go inside the clinic with him, and Endgame is about hospice and end of life, but he just did palliative care, which is a much bigger, as Rick just said. But he talked to people about the dying process, and that's a really good way to kind of see how he works. So if you're interested in kind of seeing some of BJ's philosophies, his backstory, I really recommend the Netflix documentary Endgame.
Alexa said to me, when I said we're going to use BJ Miller, she said, "Oh, I can't. Can I meet him? Oh, can I?" And she was like, it was like I was telling her some rock star was coming in. But he is really great. I'll put the TED Talk. I'll put the TED Talk in the chat window for you, because that's a quick way to at least get a sense of him. And he lost his limbs he was fooling around. He was at Princeton University. He was on the rowing team, and he and his buddies were fooling around one night on top of one of those tram car things, and he got electrocuted. So,
I mean, I think the biggest compliment we can give to BJ is he mesmerized Oprah. I think, and that's when she was just doing her own thing. She has been around and has gotten to talk to so many people. And if you impress Oprah, I think you're doing pretty good.
Can I just add something for the anxiety that?
Sure.
Yeah, of course.
So obviously, Rick was my husband was a firefighter and didn't do anxious and wouldn't go there, but obviously he did become very anxious and started to suffer with panic attacks and things like that. But he found something called EFT, which is a tapping, which doesn't work for everybody, but he found that really helpful for him. And having Reiki leading up to scans and things like that, he did a lot of Reiki, EFT, just before going into scans and going in to see doctors and things like that. And that really did help with his anxiety, which I didn't think it would. You've got to be that way, but it did really work for him.
Tell us what EFT is, Nicola.
It's like you tap on your pressure points and sort of your negative thoughts. It's I think if you Google it shows you like a diagram of what to do, but he actually saw somebody.
Emotional freedom technique, is that what it stands for?
Yeah, it's let's see if I can
Chris, I saw you on
yeah,
mute.
emotional freedom technique. Yeah. But he saw somebody professional who was trained in it, and then they trained me to do it on him. So when Rick was end of life, that was the only thing that I could do to like help. He wanted me to do it. He would actually say, "Will you tap me?" and things. And yeah, so it did just, his anxiety would just really come down through that motion. So it's worth a go, I think, looking
Yeah,
into.
and the other thing which I encourage you all to consider is that sometimes medical marijuana, if you get the right, if you have the right combination, it can also relieve a lot of stress for you. You know, it needs to be CBD dominant. I'm not a great expert. We've got some good links on our site on medical marijuana, and I also don't know about the availability in Texas. It may be much more difficult. I can't imagine Texas has made it available, but it doesn't stop you. If you can get a card, and I'm sure you can get a card at MD Anderson, it doesn't stop you going to get it in from another state, right? Alexa, you probably know more about this than I do. I shouldn't be saying anything.
Yeah, you can't even get a card in Texas usually. It's a very difficult process that I think is going to actually go to a ballot. In Texas, if you get a certain amount of signatures, you can get something on a ballot. I think it's something we're going to be voting on within the next few years, actually. And according to most Texans and most polls, they believe that medical marijuana should absolutely be part of our system. It's just been a difficult and complicated thing.
But you know, if you got friends in other states, and I know people that do that they will pick up gummy bears for you or whatever it is, and you try it. You see if it helps. If it doesn't help, you don't take it again. But it can be helpful. We haven't heard from the captain. He's awfully quiet there.
Just just listen to everyone. That's all. But I'm talking about scan anxiety. I get it around. This time, like I got my scans coming up on the 19th of this month. So um, I'm looking forward to that. I guess this will be my fourth. I'm speaking into existence. It's gonna be my fourth clear scan. So I'm kind of looking forward to it. I get a little anxious or whatever, but you know, I'm looking forward to it. Ready to, go knock it out or whatever. I'm looking
Andre,
forward to. Go ahead.
I was going to say, how did you handle the early scans when you were anxious? I mean, what words of advice do you have for Brian on how to handle those scans early in the game?
Whew. In the beginning, I didn't really know how to handle it. Like, man, I kind of really leaned in. You know, I'm a spiritual person. You know what I'm saying? So I really like leaned in on the spiritual side, and I got a chance to talk with uh, Carlos, Carissa's husband, when I was down in Houston. And I talked with um, Core Connor. Her brother is a survivor of RMC, so I got a chance to talk with her as well. So that really, kind of gave me, some hope and some inspiration or whatever, to keep pushing and keep moving forward. But I just really had to go in thinking, just thinking positive and speaking positive about the situation is really, how I dealt with it. I know before me, I went in, me and my mom, we would have a talk and we would, just, talk positivity and talk, positive results. And it wasn't, all the scans wasn't positive or whatever, but we always kept that faith and kept believing like, hey, what do I got to do next? I'm gonna keep pushing forward and keep moving forward or whatever. And the first first chemo combination treatment didn't work. Well, it worked for a little while, but then the cancer would kind of came resistant to it. Then I went to like immunotherapy. That worked for a little while, and you know, and the good thing about Dr. Masal, you know, once a scan, once something stops working or whatever, he's definitely gonna push on to the next thing. So that kind of was my mindset. You know what I'm saying? Okay, this is gonna work. You know, when it didn't, we kind of moved on to the next thing, and my mindset just kind of always stayed positive. Um, and then like, you know, my last chemo treatment with the radiation, man, I just knew that, you know, my scans was gonna be clear. I went in already knowing it. So yeah, I just, you know, kind of lean more into my faith and trying to stay positive and keep that positive mindset. It's kind of, you know, how we dealt with it, you know, the whole way, you know, because, you know, it's an aggressive cancer, but you know, it can be beat. And once I read, because I was at Walter Reed, and you know, this is a story I shared, you know, at Walter Reed after I had my nephrectomy or whatever, you know, the oncologist came in, and you know, people ain't that familiar, as y'all know, with RMC or whatever. So he came in and was like, you know, hey, your prognosis is only like 4 months to live or whatever. And at the time, me and my sister was in the room. Um, so he came in, he told me that, you know, he told me I was supposed to went to a cancer center up there in Maryland or whatever. But man, you know, me and my sister, we prayed about it, you know, kept thinking positive or whatever. And then like literally like the next day, like two social workers from Walter Reed came in, they brought in Herman Story. So it's actually funny, me and Herman the same age, but he was diagnosed with RMC, you know, years before me or whatever. So once I saw that, you know, hey, they gave up on him in South Carolina, but he beat the disease. You know, that's all I needed to, you know, kind of uplift my spirit or whatever. And I let the military know. I was like, you know, I need to get down to MD Anderson, you know, and to kind of fight this battle or whatever. So once once I saw that, I mean, that's all I needed. I mean, and I just kept thinking positive from there or whatever.
So we
Well,
have, oh, I'm sorry, Rick. I just want to say, Carissa had unmute a couple times, and I will make sure whatever you wanted to say, you say it.
Oh, yeah. Well, I did the EPT or what Nicola was talking about. It kind of reminded me of Reiki, but like with Reiki, you don't actually touch, but it's kind of like a
It's
sense.
similar, yeah, it's similar, yeah, yeah.
And I know Carlos had gotten that sometimes, and he when we were in New York City, and he liked having the Reiki experience, so that was good. And then oh yeah, when we were talking about just like the marijuana, I remember like talking to the supportive care group over there, and they were like not supporting it at all. Yeah.
did Carlos use medical marijuana in Jersey at all?
Towards the end, he did like a little bit. I don't know. I guess it helped a little bit, but I don't think like too much, because he had to like do lozenges, and he did have some of the gummy bears though, and I think he liked the gummy bears for sleeping, so that was good. Like that helps him sleep.
We have a lot of guys with advanced prostate cancer who use the medical marijuana to deal with anxiety. So that's really where my recommendation is coming from. It's all based on actual use, and these guys, I mean, of course, they're getting regular scans, they're getting their PSA and their bone scans and this scan and that scan and the other scan, and they find it helpful. They find it helpful for that. They find it helpful for nausea. You know, when you're going through chemo, it can be very helpful in dealing with nausea. I mean, medical marijuana is not curative. It's not going to cure your disease, no matter who tells you about Rick Simpson oil or suppositories or anything that you want to talk about. No, doesn't work. But it really does work to help with symptoms. It's really, really significant with symptoms. I just wanted to say, I posted this in here. I posted it in the chat window. I put 2 podcasts in the chat window. And I was reminded of it because Andre said, the captain said, it's very, he relied on his faith. I've been supporting a wonderful, wonderful guy for many, many years. And his disease is getting tougher and tougher. And he is a man of faith. And he just recorded 2 podcasts, one of his own and one with his wife. And I really recommend you to listen to them. I mean, it's not sort of riddled. It's not a Bible bashing podcast, but he's amazing. And for the caregivers, just to listen to how he and his wife interface, I think it's just remarkable. So I put them both. You can click on both of them, and we'll be blogging them when the person that keeps Ancan ticking over has a few spare minutes. So, but we will be blogging it. So make sure you sign up for our blog and you'll see it there. But I really can't recommend them enough. It's really, really worthwhile.
Also, they're great to listen to in the waiting room before a scan.
Oh yeah.
So that could be a practical way to help with anxiety, because that's going to be very encouraging.
Yeah.
So just a suggestion. So we are at the end of our time, but I wanted to make sure, Richie, you had asked about, hang on a second. You had asked about maybe some topics or things for next time. I wanted to make sure everyone got their voice heard on that if you had a suggestion. I'm going to take that as we don't have any additional suggestions, but Richie, you know everybody in this room. I'm pretty sure we all have either your phone number or your email address. And I am certain that if you think, if anyone thinks of anything, they know how to find you, and you'd be happy to receive any suggestions.
And
That is correct.
I have a very quick question for the captain. Are you now officially retired, or are you job wise, how are you doing there? How are you keeping busy?
I'm not retired yet. I actually got I got my formal board on August the 12th. So this Thursday actually. So yeah, so after Thursday I will kind of know more or whatever, and they'll kind of give me a separation date. So kind of looking forward to that. So yeah, this is a big month. So a lot going on, job front still kind of, it's a process. So still kind of looking and trying to figure that part of it out. You gotta get ready to, go on interviews and, all that stuff or whatever. So, gonna be part of the civilian population again. So
You are. But the thing is that you are a man in demand. Everybody wants logistics people.
yeah, so I'm looking forward to that next journey. I did have a quick question though. Are they allowing visitors back in MD Anderson yet? Okay, so they are.
I wouldn't be surprised if they don't stop pretty soon again.
Yeah. Currently, I think you can have like one person with you right now.
Okay. All right.
Yeah,
Thanks. Appreciate it.
Oh,
I think
I
they
also
just
just
reopened, didn't they? Open it up to that one person recently?
Mhm.
Yeah.
I also just wanted to mention Lamar. I don't know if anyone's familiar with the Lamar James story, or Lamar James. He was okay. Well, he just posted some news, I know, on his social media, which he's real open to like sharing his journey. But he just posted news that his scans are no evidence of disease. and he's also an RMC patient. I think he posted this past week. I'm also like in contact with him. I think he's awesome, and he's been very willing to share his story. But it's really excited. He posted the audio to his doctor's visit, and it's just him saying like, "There's nothing." It's like, and it was pretty great. I shared that with Brian earlier this week.
Wow.
I've been trying to get Lamar to get on these calls, but he hadn't made it yet. So we'll try maybe for next month.
Positively.
Very well.
Of next month, our meeting next month is on September 14th. Same room, same time, same place.
Andre, you wanted to say something.
Oh, I was just gonna say, I love hearing, those positive stories. We think of RMC as, rare cancer and the prognosis isn't that good, but it's a lot of people that's actually, beating this disease, and I want to get those stories out there so it can give, more people, hope or whatever. So I know that's kind of what drove me in the beginning. So, so the more stories, I hear about, clear scans from RMC, the more invigorated I get, the more happier I become. So I'm happy to hear that. So,
I just had a thought. We record these calls, as some of you know, so anybody can listen. And Nicola, please, if you wish, please repost them on the recordings so that, like the person that couldn't make the meeting can listen to the whole meeting. Please feel free. You don't need permissions or anything. Anything you want to take off of our site. And if you've got any questions, just touch base with Alexa. But please, spread the word any way you can.
Yeah. I was wondering how I could maybe get this to them actually, even privately, but
You mean the recording?
yeah.
Okay, so these recordings are we post them to our YouTube channel.
Right, okay, yeah.
So they're available for anybody to listen to.
Yeah.
And I'll let Alexa and you will figure it out, but we'll show you where they are. And then I know Richie does something with them, because all of a sudden there's like 5 people watched it, and then I look again and there's 20 people watched it. So I don't know what's happening there, but yeah.
I post them on Facebook.
There you go.
Right. Yeah, right.
But we'll try and remember. I'll try and remember, because I usually send the recordings on to Richie, and I'll try and remember to copy you when I send the recordings on to Richie. I'll try and remember to include you in that, so you'll have the link, and then you can post it on your website too.
Brilliant, yeah.
And the old ones are posted there too, so you can go back and listen to some of the earlier meetings as well on the on our YouTube channel archive thing.
Brilliant.
All right,
guys,
everybody.
Run over to make sure those MS people those multiple sclerosis people are behaving. So I'll see you guys later. Goodbye.
Bye, Rick.
Bye.
Good night. Thank you.
Night, guys.
Everybody,
Nice meeting
this
you,
was
everybody.
such a good meeting. This is such a good meeting. We hope to see you back next month, September 14th. You will get a reminder if you're signed up for our reminder list, and this will be posted online. So if you guys need anything in between time, please reach out to Richie. And if you need anything from ANCAN, please reach out to me. And we're always here for you. Isn't that right, Richie?
That's right. And I hope
Always
everybody's
here for you.
okay with this being posted. I hope. Are you?
Brian, we're okay with it being posted, because I mean, obviously none of our family members or anything follow, like they would have no reason to follow the group. I will say we are in general, Brian's very private with his diagnosis as of right now. It's not that he's hiding it or anything. He just, I don't know.
I mean, I'm fine you posting it. It's just, I'm not
We
I'm
don't,
not just,
with the recordings, there's no names that are shown or anything like that.
okay. All right, fine.
Okay. We just want to make sure.
Mhm.